A black woman with a college education is losing babies at a higher rate than a white woman who didn't finish high school.
There's an understanding that the racial disparity of infant mortality is awful.
Pregnancy affects every single part of your body. So that's mind, body, and spirit.
Stress of being black and pregnant.
I think it's important that we always keep in mind the historical perspective of how we got to this point in the first place.
Do not tell me you don't see color, because my people have fought for you to see their color.
I believe in change. I believe in progression.
From WLWT, this is Let's Talk Cincy, presented by Western and Southern Financial Group. Put our financial strength behind you.
The birth of a new baby is one of the most exciting times for new parents, but it can also be a scary time, specifically for a certain demographic. Welcome to this special edition of Let's Talk Cincy. I'm Ashley Kirkland. Well, September is National Infant Mortality Awareness Month, which is a time to bring attention to the number of babies who die before their first birthday. But black babies are overwhelmingly being impacted, dying at 3 times the rates of white babies. And in many instances, the socioeconomic and educational status of a black mother does not make a difference in her baby's chances of survival. Now, while these statistics may seem dismal, there's now a coalition of people across Ohio looking to give these babies a fighting chance. Let's go beyond the numbers and hear from 2 women who have experienced the pain of losing a baby and how they're turning their pain into progress to make sure no other woman has to go through this same tragedy.
Dear Farrah, each moment away from you already seems like eternity.
The unimaginable death of a child, that's a loss no mother wants to experience. But the heartbreak that thousands of women like Jara Boyd and April Griffin live with every day.
I feel like after it first happened, I was like angry, I felt guilt, I had all these different emotions.
So I was mad with God for a long time. I'm 63 and that's the only time I've been pregnant.
In 1977, April Griffin was pregnant at 19. Her then military husband came from overseas for a short time to be there for their baby's birth. But nothing went the way that she thought it would go.
I spoke to my obstetrician. He says, okay, go to the hospital. You check my blood pressure 3 times that day. Go to the hospital. I went to the hospital. They started IV in my arm, and all hell broke loose.
Griffin said she knew something was wrong when she began breaking out in hives all over. She says her nurses still insisted nothing was wrong until it was.
The next thing I remember is waking up and I see 2 monitors, one with a wavy line and one with a flat line. So they came in and said, we're going to do an emergency C-section. They took me in to do the emergency C-section, and it didn't work. They dropped me on the floor. Then they said, well, the baby's dead. We got to get the baby out.
April's husband had to go back overseas while she was still in the hospital.
And then one day, people came into my room, my mom and the family. Everybody's dressed in black. I'm like, what's going on? They'd had the funeral for my son. And I mean, my whole world fell apart.
April says she did everything right during her pregnancy, eating healthy and staying active. Jara Boyd says with her loss, everything happened fast.
My stress levels were up, and I was out with my mom somewhere, and I felt some fluid rush down my leg, so I knew something wasn't right.
Her mom rushed her to the hospital.
And they hooked me up to all these devices, and they basically looked on the screen and they said this baby's kicking her way out and there's nothing we could do about it.
Just 20 weeks into her pregnancy, Jara gave birth.
And she came out and I got to see her and hold her and pray over her, and then she was gone.
Baby Farrah only lived 10 minutes on Earth, but eternally in her mother's heart.
Each moment away from you already seems like eternity. I wish I could cuddle you with kisses and feel your warmth and stare at your innocent little face for the rest of my life. You will always be mommy's special angel.
Now, the mom of 4 has turned her pain into purpose, being an advocate for other women during their pregnancies.
I think it's very vital, especially for women who have endured infant loss, to reach out to other women and let them know that they are not alone.
Some 44 years after her devastating loss, April Griffin is also using her experience to empower women to ensure they have healthy pregnancies and deliver healthy babies.
I don't want any women to be sad about losing a baby. So I do talk to them about taking care of themselves. I try to get them to bring the fathers in for their OB visits so he can be a part of this.
Both women using their knowledge to encourage others to take care of themselves mentally and physically during their pregnancies and even before.
I thank God for allowing me to be the vessel to which you came through to share your life.
To hopefully change someone else's narrative.
I will always love you and thank God for you, Fair. Love, Mommy. Something you will never forget, never.
Just a powerful story there. Well, getting additional support in the delivery room and beyond just loved ones.
Giving birth in itself is a very vulnerable experience.
The emerging doula field, how these trained professionals are helping mothers before, during, and after birth. For 9 months, a mother's body is home for her baby. Therefore, her baby's health goes hand in hand with hers. The doula movement is now helping drive a more happy and healthy experience at all points of motherhood. For every baby born, there's a mother with her own unique birth story. Some are simple. Others may be more complex and come with challenges.
I went to the hospital at about 9 centimeters and I wanted an epidural, and I had to talk to several nurses who are like, well, let's just push. And I'm like, give me an epidural.
That was Sashida Tafari's experience, her second time giving birth. But as a doula who often supports women in the delivery room, she knew how to advocate for herself.
Eventually, I just said, I don't want to talk to you anymore. Go get the midwife. I want to talk to her. The midwife came in, and then she said, let's give her an epidural.
But not every woman may feel empowered to speak up.
So I was able to advocate for myself in ways that I know that families who don't know anything about childbirth, or families who are not confident and don't have anyone with backup support, are able to do for themselves.
Her mission as a doula is to make sure a client's birthing plan is followed.
Giving birth in itself is a very vulnerable experience. And when you are in the midst of a contraction and someone is asking you a question, or they are propositioning you with things that you probably didn't want or probably didn't even think about, then you are more likely to go with what they say.
Tafari has unfortunately witnessed veiled racism within the medical field.
So that can be just simply walking into a doctor's office, patients not being addressed by their names, or being drug tested several more times, or having their babies drug tested without consent, or without even saying, hey, this is what I'm putting on your baby, to see if they have any type of drugs in their system or things like that. There's a lot of microaggressions that happen within the system.
A doula's job also goes beyond the doctor's office and delivery room. It extends to the home, helping a new mom navigate her new norm.
We are helping them prepare nutritious meals for themselves. We are checking on the baby. We are holding the baby so mom has some time to really tend to herself, to get herself together and okay throughout this whole experience.
Well, the poet Maya Angelou once said, you can't really know where you are going until you know where you've been. To understand this infant mortality issue, we have to first confront America's past.
I think it's important to always remember the historical perspective of how we got to this point and why we see these disparities.
Still to come on Let's Talk Cincy, how this medical crisis began brewing centuries ago. Welcome back. As with any health crisis, issues don't just spring up overnight. That rings true for this current coronavirus pandemic and even the opioid epidemic. But when it comes to the infant mortality crisis, you have to take a look much further into America's past. Lacey Roberts has this story.
History shows that Black mothers have the highest rate of infant mortality. Although those numbers have made a slow decline, let's go back to the beginning. The history of where it started and where we can look forward to.
If we go back to slavery, the whole transatlantic slave trade, we see that, and we've heard the horrific stories how Africans were put on these ships and they were brought across here. But there were also physicians on those ships that we don't necessarily talk about. And those physicians had a very vital role in keeping Black women alive.
Dr. Edward Wallace with the University of Cincinnati's Africana Studies Department specializes in community health and looks at health disparities.
We tend to see a lot of women become hopelessness, detached, suffering from depression, and so that has this impact on them, which is going to impact them physically as well as mentally. And we see this a lot in terms of women who are actually pregnant, which is going to actually impact their health as well as their baby's health.
One of Dr. Wallace's main areas of focus is racial and ethnic health inequalities.
We're talking about a group of people, primarily African Americans or Latinos, who tend to have less access or do not receive the same treatment as those within the white population.
The beginnings of these racial health disparities date back centuries.
These white physicians were also very much in partnerships with the slave owners because they understood that if I have this Black woman of childbearing age, then what I can actually do is I can enhance my own medical field and my own medical profession in terms of developing my own stature as a physician.
The impact is still sending shockwaves within the Black community, with the ripple effects on Black mothers and their babies even more profound.
A lot of physicians, particularly white males, have benefited from experimenting on Black women's bodies, particularly looking at how much pain they can actually endure.
And while the experiments are now just evidence of America's past, the stereotypes still persist.
I think what we hear from a lot of these Black women, they're echoing just what their mothers and their grandmothers and their great-grandmothers have been saying for decades. You know, that they're not listened to, that they feel as though that they don't necessarily have pain when they're actually giving birth and things of that particular nature. Many of them are caregivers. Many of them are the financial person responsible for bringing the money into the household. They're the protectors of the children. And so they're very, very strong. And then somehow society tends to tell them, well, that's not good enough.
And so does racial bias.
There is very much racial bias within the healthcare field, but it's also something that can actually be fixed. You have to see this Black woman as a Black woman. You have to see her as your mother, see her as your aunt, see her as your sister. And when you have some empathy, then I think we'll be able to actually close that health disparities gap around infant mortality.
Lacey Roberts reporting for Let's Talk Cincy.
Wow, what a powerful perspective there. So how do we make way for a better tomorrow? For Ohio Governor Mike DeWine, the situation was too grim to ignore.
I think it should shock all Ohioans that we're losing Black babies at a rate of 3 times what white babies die.
It's a hard pill to swallow, especially when you break down the latest data showing the exact numbers in which Black babies have died in the state before their first birthdays. The infant mortality rate is calculated by the number of infant deaths per 1,000 live births. In 2019, Ohio infant mortality across all races was 6.9 per 1,000 live births. 929 babies in total died that year. Among white babies, 519 died that same year, a rate of 5.1 per 1,000 live births. Among Black infants, the rate soared well above their white counterparts at a rate of 14.3 per 1,000 live births, up from 13.9 in 2018.
So these are just unacceptable numbers, and it's not the numbers, it's the babies that we're losing.
Late last year, Ohio Governor Mike DeWine put together the Eliminating Racial Disparities in Infant Mortality Task Force. The goal? Come up with a statewide plan to reduce infant mortality rates and eliminate racial disparities by 2030.
I'm a pretty impatient person, particularly when I see what I consider to be injustice. I mean, it's not right.
To head up the task force, DeWine looked to a diverse group of medical and public health professionals who were familiar with the problem on a state and local level.
Some of the people on there had certainly some very specific expertise who have done this, who have been involved in programs.
Next, DeWine's administration put forth a budget to the legislature to double the amount of money spent on home visits.
Home visiting is voluntary. No one's forced to do it. But it really reaches out to mothers, sometimes mothers and fathers, helps them before that baby is born. Sometimes it's as simple as making sure the mother is able to get to her prenatal visit.
One key focus, education for parents and healthcare professionals.
It's basic things that I think most people take for granted. I'm sure there's some people watching this who say, well, doesn't that happen for everybody? And the truth is, it doesn't always happen. And we need to make sure those things happen.
Along with increased home visits, the task force began regular listening sessions, hearing from Black mothers and parents about the disparities they faced in the delivery room and beyond.
These are innocent children. You know, they have a right to live. They have a right to have a chance, and merely because what their race is, or where they live, or who their mom is, or families in poverty, you know, these things should not matter. This is 2021. We ought to be able to figure this out.
How do we get all Ohioans to care about this issue, especially those in the medical field?
I think most people in Ohio don't realize that we're losing African American babies at 3 times the rate we're losing white babies. I think most people will be shocked to know that. I mean, it's a stunning number when you think about it.
As Ohio's leader, these disparities in infant mortality are unacceptable to DeWine.
We shouldn't tolerate it. We shouldn't put up with this. We can change it.
And as a parent who's experienced loss himself, he knows the pain is unforgettable.
Whatever the age, you lose a child, that stays with you for your whole life.
And Governor DeWine actually visited Cincinnati back in 2019 when he heard about the success Cradle Cincinnati was seeing in reducing infant deaths here in Hamilton County. The statewide 2020 report on infant mortality has not yet been released. However, the governor says the work the task force has done already, they're seeing progress. Well, still ahead on Let's Talk Cincy, getting to work on the governor's task force. The 2 Cincinnati doctors looking to make a difference and help drive that change when we come back. Getting to the bottom of what's causing early infant deaths, particularly within the Black community. I sat down with 2 Cincinnati doctors serving on the governor's task force and trying to come up with solutions in the process.
When we think about infant mortality and Black women losing babies at an alarming rate, at the most extreme in the United States, we had to think about how to fix the problem for Black women so that we could then fix the problem overall.
The alarm has been ringing for a while, to be very blunt.
2 very different doctors with one message and one mission.
We agreed that our mission would be to eliminate infant death. And that's aspirational, of course, and really, really hard to do. But how can one ever say that the death of any child is an okay thing? It's not. So our work isn't done until there are no deaths.
So let's go to where the work first started in Southwest Ohio. Cradle Cincinnati was birthed in 2012 as a collaborative effort and a commitment to reduce infant mortality in our community.
In the mid-2000s, the first decade of the 21st century, we here at Cincinnati Children's became increasingly aware of very high infant mortality rates in our region.
From 2006 to 2008, Hamilton County was the worst urban county in the United States for infant mortality. In his work at Children's Hospital and with Cradle Cincinnati, Dr. James Greenberg scoured the data to get to the root of the issue.
We discovered actually it was hard to get data. That was one of the problems early on. Even though we knew what the infant mortality rate was, what we didn't know is who's dying.
It took several years to get to the bottom of those questions, but they did discover the biggest driver of infant death.
Black babies, and specifically black babies who were born way too early.
So what exactly causes prematurity? Is it poverty or education? Why does a black woman with a college education have a greater chance of losing her baby than a white woman who didn't graduate high school?
The confounders of poverty or housing or education don't explain it.
The other factors researchers look to: stress and racism.
The stress of being black and the stress of being black and pregnant.
Last year, Hamilton County declared racism a public health crisis. To learn how to better serve black women, experts had to start listening to black women.
So what we heard black women say when we went out to listen to them was, I don't feel heard, I don't feel seen, I don't feel valued.
Were you shocked by anything that you heard, or?
So the short answer to that question is no.
Are we speaking to racism in the external, what they face on a daily basis, or racism when they come to the hospital or go to their doctor's appointments? Because we have heard that.
Yes. And we've, by the way, heard that loud and clear.
Of course, there are many biological factors that can impact a pregnancy outcome. Dr. Greenberg says medical professionals are working hard to understand how a woman's experiences, as well as who she is, gets translated into the biological event of delivering a healthy baby. But he acknowledges there's much work for healthcare providers to do to create a better environment for future black mothers.
One of the most important things that healthcare can do is expand our thinking. And by that I mean thinking about those other things and thinking about how we deliver care and whether what we're doing has an impact in terms of racism. Systemic racism in particular.
Dr. Meredith Shockley-Smith has been in the trenches with Queens Village, which is an extension of Cradle Cincinnati. She says there is evidence that the space they've created for black women to amplify their voices and celebrate them is working.
After we started to create an intervention that they asked for, we saw change. And so the first year that this happened, we saw infant mortality go significantly down, the lowest infant mortality rate that we had seen in Hamilton County. The following year, it went down even more. And currently, we are on track to see that trend continue.
So there is hope, and we want to thank the women who have shared their very personal stories with us. And thank you to Governor DeWine, Queens Village, Me and She Doula Services, Children's Hospital, also Dr. Greenberg and Dr. Shockley-Smith, as well as Dr. Edward Wallace and the Freedom Center. Curtis Fuller will return next week for another edition of Let's Talk Cincy. Thanks for joining us.